Dr. Zaim Abbas. Okay, I have done USMLE Step 1 and 2 CK, and USMLE Step 1 is passed, and USMLE Step 2 CK with 261 score. Okay, I am choosing almost from 1.5 years. Okay, I have started this 1 month session for both USMLE Step 1 and 2 CK. In this 1 month session, okay, there will be fast revision of. In USMLE Step 1, we will revise the first aid line to line. Okay. In USMLE Step 2 CK, okay, I will revise your notes. No doubt, everybody can actually study good, but with me, okay, we will cover the whole first aid book in just 1 month. Okay. Daily, there will be 3 hour lectures, and these lectures will be recorded and will be given on the daily basis so that you can revise if you have missed anything. Okay, and after the end of this 1 month lecture, okay, I will provide you 3 month free subscription of those recorded lectures so that you can again open these lectures and revise. Okay, so this is first lecture of USMLE Step 1 First Aid. So I have selected 4 main topics. Okay, all are difficult topics. When I was preparing for USMLE Step 1, okay, so I found these topics were difficult, but these topics are high yield. First topic is these lung auscultation. Next topic is the lipid disorders like hypercholesterolemia. Third topic is okay acid-base disorder. So fourth topic is pericarditis. Okay, and guys, let me clear you. You can read this book well, but with me, we will cover line to line interpretation of this book. I will add usual points that are missed here. For example, there are many topics not covered by first aid. So just I am giving you one example, like the small bacterial overgrowth is not mentioned in the gastrointestinal system, but given in the usual. I will cover that topic, and also no doubt you can read the book, but with me, with okay, I will tell you how questions are made from first aid, okay, which lines are important, okay, which lines are hygiene, which lines are not given here, okay. So in this 1 month lecture, we will cover first aid, we will cover important usual points, we will cover NBME points, okay. So here I am not just to give lecture and just go away. Okay, you can ask me any your question on the WhatsApp. Okay, you can send me your question, NBME question, and take help. Okay, that's second. Third, if you feel down, you can call me for motivation. Okay, so you can also can take reviews from my previous student. Okay, so I'm here till your exam. So let's start with this first topic. Okay, so first topic is the lung auscultation. Okay, this topic is high yield. Okay, but this is a actually tough topic. Let me make easy for you. First, I will make notes some on these whiteboard. Then we'll move toward first aid. So here are my mnemonic is rabbit. RBT rabbit. Okay, this is mnemonic to cover all the. Don't do that. Okay, so let's start. So first mnemonic is a rabbit. So first is R, then B, then T. Logical. So mnemonic was your rabbit, R, B, and D. R for resonance, okay. Then B for brass sound, and D for treacle damage. Okay. This easiest way to cram this. I know when I was preparing for this topic, I was overwhelmed. I was and okay, and this topic is high yield for you word. Okay. So let's start. First, I will take resonance. Okay. So there are 2 points. Okay. If there is resonance is increased, okay, if the resonance increase, or you can say hyper resonance, sound is hyper resonance. And remember, this will be guys your pneumothorax. This will be your pneumothorax. And if the sound is resonance is decreased or normal side, then we will move toward our next point, that is the B, breath sound. For breath sound again there are two. If the breath sound are increased, increase breath sound, okay, that will be your consolidation. Consolidation. Or you can say that that can be pneumonia. Okay. Next mnemonic is your T. Okay. T for tracheal deviation. And guys, remember, resonance is increased only pneumothorax. In rest, all of other disorder, okay, resonance will be normal. Remember. And then I am talking about breath sound. Remember, breath sound will be increased only in consolidation and pneumonia. Breath sound will be normal or decrease in rest of all, like in pneumonia, in other disorder, in all. Okay, we will discuss almost four. Okay, disorder here. In all other three, breath sound will be normal. Okay, so let's start with this trachea, tracheal deviation. Okay, tracheal deviation. If trachea deviate away, and if trachea deviate toward, if trachea deviate away, okay, that will be pleural effusion. That will be your pleural effusion. And if trachea deviate toward, that will be atelectasis. So how you can cram that? Okay, in local language, a word I use, okay, P for pray. You know, I think that is a Punjabi word, plurification for pray. If trachea is deviating away from the, okay, issue, okay, that will be plurification. And atelectasis is like that, like you can say in simple language, atelectasis is like उस तरफ आ रहा है. So that like A for आ रहा है, उसी तरफ आ रहा है. So if the anti-lactation is present on the right side, okay, trachea will deviate toward the right side, means to the same side. And if the pleural fusion is on the right side, trachea will deviate toward the left side, means toward other side, means पर deviate करेगा. So that's all about. Okay, and remember, okay, and the word P for pneumothorax in this trachea division will be also towards opposite side. So you can make a mnemonic for P mnemonic, mean it is pare, it goes away. Okay, so that's all. Okay, we can repeat that too. Okay, go in this way. Some students start annotating my whiteboard. Be mature, guys. Okay, again starting. Okay, so that's all about. Let's start here. Okay, so now we will study the our first aid is the mnemonic we have covered. So first is the pleural fusion. You can clearly see that okay, breath sound are decreased. Cover the mnemonic RBT. In RBT, in only in the you can say consolidation your breath sound will be increased. In rest of all, breath sound will be decreased. So let's start from RV. So first I will cover resonance. Resonance, okay, is increase only pneumothorax. Okay, the pneumothorax is hyperresonant. Rest of all will be dull. You can clearly see that. So resonance is covered here. Then is the breath sound. Breath sound is increased only consolidation. In rest of all, breath sound is decreased. Okay, and next is the you can say T for tracheal deviation. Okay, for tracheal deviation, you can see these two. In atelectasis, it will deviate toward the lesion. So you can make a mnemonic atelectasis A for atelectasis A for उसी तरफ आ रहा है, coming toward that side. And for P for परे जा रहा है. Okay. Also, you can have another P in pneumothorax. In that P, that will be also परे जा रहा है. And guys, remember, this topic is so high yield for USMLE Step 1, okay, 2 CK, if you're preparing for FCPS, MDMS, and any exam, even in prep, this topic is high yield. Okay, don't cram that topic, just go within that demonic. Grab it. Okay, ask for resonance, clear the resonance, then go toward breath sound, okay, and then move toward tracheal deviation. The topic is done. Okay, if you have any question, you can actually write down and ask me on the WhatsApp. Next topic is